Hi everyone, I'm Dr. Banawa. I'm our geriatrician here at the Sun City office. I'm here with some exciting news. We have a new doctor joining our Rancho family. This is Dr. Stephen Ching. He's an internist, which means he did his training in internal medicine, and he's here to tell us a little bit about himself.
Hi everybody, my name is Stephen Ching. Thank you for the wonderful introduction. I actually grew up, I'm a Southern California native. I grew up in the city of Monterey Park, which is a small city in the San Gabriel Valley area. And I went to high school there, and after graduating, I went to the University of Riverside University of California, Riverside.
Nice, that's great.
After completing undergrad there, I matriculated to medical school at UCLA, and after completing that, I moved on to complete my residency in internal medicine at St. Mary Medical Center in Long Beach.
Okay, great. So lots of wonderful places. You've had some excellent training. What's your philosophy to providing care?
As far as my philosophy to providing care, I like to, really get to know my patients as far as not just their medical conditions, but actually as a whole, like them as a person, what kind of job do they do, and kind of their background to get an understanding of, the multitude of factors that can that influence their health.
Yeah, and so health and wellness.
Absolutely.
When you talk about health and wellness, what does wellness mean for you as a physician?
Wellness to me, as a physician, my goal in order to instill wellness in others is to ensure that they have a happy and fulfilling life. And I think that when one is happy and enjoying life, then all is well.
Yeah, this is true. So now that you're coming out of your medical training and you have a little bit more free time, what do you like to do for wellness?
As far as wellness, I enjoy exploring the outdoors. I really love to just go on hikes or go on runs, or even cruise around on a longboard sometimes.
Oh, you do?
Yes, I do.
That's really funny. What are some things that you're noticing when you're taking care of your patients who maybe are a little bit more isolated or away from family? What are some strategies that you give them to help work on their ability to maintain, a sense of community, even if they're far from family? What are some things that you recommend that they do?
Well, given that we're currently in a pandemic, it has proved extremely challenging.
Right.
And with the stay-at-home orders, with isolation, or it's just been very tough, especially for those for the elderly. In fact. Because I believe that their vitality comes from mental health also plays a big part as far as interacting with other folks.
Right.
And for them to not be able to get out and about, and I think that it can be very detrimental to their mental health.
Right. I think a lot of our patients have been struggling with the isolation also because we are so community oriented as human beings. We like being around people and with people. And I think that some strategies that my patients have found very effective is actually things like meditation and mindfulness. There's actually a lot of excellent resources that you can get from the library or on the internet that just teaches you how to organize your thoughts and focus and sit with them. One of the things that we do here at Rancho is we have a senior center, and so we actually have classes several times a week. We do yoga, we do Zumba, we do balance classes, and we've been able to stream those classes for our patients on our internet websites, and that's been really helpful. And we actually have a lot of people participating, which is so great. So they're signing on, they're doing the classes, and that's really wonderful. So we definitely try to encourage not only the physical activity, but also the mental health. We talk a lot about nutrition as well. Do you have any strategies for nutrition that you recommend to your patients?
As far as nutrition, I like to keep it simple. And there's many diets out there. There's keto diet, there's the Mediterranean diet. I noticed that a commonality between all those diets is that they essentially incorporate a lot of vegetables, fruits, and try to stay away from anything that walks on four legs, and to incorporate more like a fish in the meal.
Yeah.
And So those are some things that I try to instill upon my patients to allow them to be able to remember it. Because if I tell them like you should follow this diet, but it's very complicated, it's very hard for them to actually sustain. Yeah. And I believe like having a diet is not only just like a plan, but it's like a lifestyle. And in order to continue and sustain that, it has to be something that's easy to remember and something that can be reasonably
implemented. Yeah, something sustainable, something easy, something that you can do and you can be consistent with.
Absolutely.
You mentioned that you love being outdoors and being physically active. For someone who isn't really active, for somebody who's sedentary but they want to start exercising and start being active, what would you recommend as how to get started and how to do that in a way that they can be successful?
Absolutely. And a great way to start, especially with one with a sedentary lifestyle, say for instance, like they enjoy watching TV or movies, which is totally fine. Perhaps they can, while they're watching TV, they can have a stationary bike or some kind of a stationary pedal for them to exercise as they're watching TV. So they can do both things at the same time. For those who perhaps maybe just like to read or stay at home, I perhaps can encourage them to perhaps take up audiobooks and actually head outdoors and go for a walk as they listen to the audiobooks.
Right. I think that's great. Doing what you're already doing, but finding some way to incorporate physical activity, that's a great strategy. As we're entering the summer, a lot of my patients are telling me, I used to walk and I used to do all of these things, but the weather is so hot that it's just not tolerable for me to be outside. Can you give us some, things that we need to consider for outdoor exercising in the midst of all of this heat, things to look out for in terms of heat-related illness that our patients should be aware of?
Oh, absolutely. And especially in this area, it can get extremely hot as we've been experiencing this past week.
Right.
And one of the important things that I would instill upon my patients is to make sure that they stay well hydrated. The body is composed largely of water, so to be able to remain hydrated is very important, as especially in the elderly, because the thermoregulatory system, or how the body regulates temperature, gets affected as we age, and we're not able to do so as easily. So be able to stay hydrated is very important, and also to stay cognizant of the timing in which you head outdoors. I would encourage you to especially stay indoors during the peak hours when it's very hot, and perhaps maybe head outdoors when it's more early in the morning, or perhaps later in the evening when it gets a little bit cooler.
Right. So some great strategies for staying safe and avoiding heat-related illness. You mentioned exercising early in the day or later on in the evening when it's cooler, the importance of staying hydrated, which is always really important. What kinds of strategies do you recommend for sun protection in terms of sunscreen or clothing? Are there any specific recommendations that you make?
Absolutely. I think it's very important to always take skin protection into account, and having a good moisturizer and lotion that has a strong SPF is also important. And it's not so much the number of the SPF, but it's more so how you apply it is what's important, to be able to apply it about like 15 minutes before you head outdoors, and after about an hour or so to make sure to reapply again, and to ensure that you have a strong protective barrier. And aside from using a good sun protectant lotion, is to also make sure you wear clothing that is light and cooling, and yet be able to sometimes offer some additional barriers of skin protection as well.
Right. I think when we think about using sunscreen, it's almost like a one and done. You put it on and you're done, but it only lasts a couple of hours. And so a lot of people aren't aware, if you're sweating, if you're outside for an extended period of time, you really need to be reapplying the sunscreen as well. Transitioning from that, a lot of skin care. So we see a lot of dry skin, we see a lot of bleeding and bruising. What are some general strategies for, watching the skin for things that are concerning or skin-related illnesses that you have your patients do? Do you have your patients doing routine skin checks or anything like that?
Certainly, I try to encourage my patients to, make sure, because they are the ones that see their
Know their
body
bodies. Yeah,
every day,
absolutely.
and for them to be able to pick out like abnormalities or something that's unusual that they haven't seen before. They know best, so I
Yeah.
encourage them to keep an eye out for
Yeah.
that. And if should they ever have any concerns, I'd be happy to, address that with them. See them in the
Yes.
office and.
Come see us so we can take a look.
Absolutely, yeah.
Absolutely.
Because some things that may look normal or have been there for a while,
Right.
and
I think that a lot of the
Yeah.
strategies that we use, especially for skin-related health, is we always like to talk about something that looks different from other things on your body. So if it's changing in any way, we talk about the ABCDEs of moles. Is it asymmetric?
Yeah,
What do the borders
asymmetric,
look
yeah.
like? Is it regular or irregular? Is it one color or multiple colors? The diameter of the lesion, is the lesion evolving or changing? So all of these things, I think a lot of our patients are really good about watching their skin, watching their bodies, and coming to see us when something seems out of the ordinary, which I think is so great. You mentioned a little bit earlier about you are the one who is attuned to your own self, and patients know their bodies the best.
Absolutely.
If a patient is noticing that maybe their medications aren't doing quite what they're supposed to, or they just feel different, what are some strategies that you like to have your patients do at home, whether it's blood pressure monitoring or glucose checks, or things that they can do to keep themselves safe at home?
So a few ways I think to be able to
Take charge of your own health.
Take charge of your own health
Right.
is to exactly, and as it's very similar to like a diary where you document your thoughts. And I think having a diary where you document your kind of health numbers is very important as well, as far as your blood pressure. And I encourage you to have a blood pressure machine at home so you can regularly check your blood pressure, and to if you're diabetic or have elevated blood sugars, to also have a glucometer where you can document your blood glucose numbers. And to have a documentation not only helps you to keep track of how your body is doing, but also it provides us as providers a way to be able to get a sense into how your day-to-day metrics are.
I think the day-to-day is so overall, because when we're seeing our patients in the clinic, it's this tiny moment in time.
Right.
And it's not necessarily indicative of how they're doing at home or how they're doing overall. And so I love when our patients are able to give us that insight into their daily lives and show us, what their blood sugars are doing, what their blood pressures are doing, because it really helps us to make the right choices when it comes to the medicines. We talk a lot about staying healthy and staying at home, especially in what's happening right now with the pandemic and all of the concerns and fears about coronavirus. What are some general guidelines you can give to our patients about what does good hand hygiene mean for you, and what would you recommend to our patients?
Good hand hygiene involves making sure that we regularly wash our hands if we come into contact with any surface or anything that could have potentially been in contact with another person. It's very important that we wash our hands. So things such as handles, doorknobs,
High touch areas.
High touch areas.
Right.
High touch areas. We want to make sure that once we come in contact with that, we want to also make sure, because we don't know who touched that before, and we want to make sure that whatever we had touched, we want to keep clean.
Yeah.
And so having hand sanitizer at hand, if you're not near a sink with soap and water is important, but if you're near a sink with soap and water, I think that's one of the best ways to keep good hand
I think
hygiene.
we forget about good old soap and water with all of the difficulties getting hand sanitizer and bleach, but soap and water is very effective. We talk about keeping things very simple. Keep your hands clean, keep your hands out of your nose and mouth, don't touch your eyes, because you can also transmit things to your eyes.
Right.
And just making sure that you are being cognizant of how you're handling things, how you're approaching other people as well. A lot of our patients have expressed concern because maybe their younger members of the family or more extended relatives are not able to come over and bring the grandkids, and so they miss their families, and it's hard for them to not be around. What are some things that you recommend in terms of the mental health and wellness, in terms of being able to stay connected with family while also maintaining good social distancing to stay safe?
Absolutely, and thankfully we live in an age where, with technology, it has really cut a lot of boundaries and made things a lot more accessible as far as virtual kind of connections go. And to be able to, not to go from a simple phone call to actually be able to speak, at least see each other's face, I think
Right.
adds a lot of value to it.
I think that that's definitely a great point. I think that we often underestimate the value of a simple connection, even if it's a phone call or writing a letter. And I think that being distanced from your family and your loved ones has really heightened that. And I think it's also kind of reminded us of what's important and what to prioritize on in life. And so a lot of our patients who maybe may have not tried to tackle it before, they're doing, the FaceTimes or the Zoom phone calls.
Yeah.
We've also been really fortunate at Rancho Family because we've been able to transition to a lot of telehealth. And so we can actually do a lot of our patient visits either through a video visit or a phone call. And so I love that our patients are taking advantage of that, because if they have a question or a concern, we can see them and we can kind of make sure that we're making the right decision for them, versus them just feeling like they're not able to see their doctor and they have to wait and they're in this kind of state of limbo and fear.
Right.
When it comes to health maintenance, would you advise our patients to hold off or continue doing their screenings? A lot of patients have expressed fear about being in a clinic or a hospital setting or in an emergency room receiving care. Can you speak to some of the things that we're doing to keep our patients safe and to continue to encourage that care?
Absolutely. And despite us going through these challenging times in 2020, I believe that continue to maintain one's health is just as important. And society as a whole, we've been trying to kind of come to terms and acclimate to the changes, but it's very difficult. And I'm very happy to hear that Rancho has really implemented measures to be able to stay connected with our patients and ensure that the interaction with our patients does not get lost, and that we can still maintain
some degree of connection
with each other, whether that's through a telephone call or even through face-to-face kind of on screen.
Right.
And I think there might be fear of going to the clinic, but we can still connect with you.
We have to remind ourselves that chronic disease doesn't stop. People still have heart attacks, people still have strokes, people still get infections, cancer still progresses. And so we as physicians are doing the utmost that we can to keep people safe, but still give them that route to seek medical care. And so I've had, a very close loved one have a surgery in the time of coronavirus, and just the measures that were taken at the hospital, from cleanliness to personal protective equipment to keeping patients, in appropriate locations. I think that our medical system locally has just gone above and beyond to keep our patients safe. And so, I would encourage our patients, if you are struggling with, pain, illness, difficulty breathing, chest pressure, let us evaluate you. We're still here.
Absolutely.
We're still practicing medicine, and it's so important to be seen, especially if you have a medical condition. Even if you think, I'll wait until everything is over and then I'll pick back up, life still happens. And so we still want to make sure that we're doing a good job with your medical conditions and with your overall wellness.
Absolutely, I agree with that.
So you're going to be in the Hemet office.
Yes.
You're going to be the main physician seeing patients in Hemet, which is great. Tell our patients a little bit about what you hope to accomplish at the Hemet office for our community.
Well, one of the driving forces of me joining the group was the fact that I was told that Hemet has an opening, and that the community there is truly in need of a doctor that can really provide quality care. And coming out of training and many years of studying, I truly want to put that into good use and truly make a difference and make an impact upon others, and to be able to help a community that is in need of that I think will truly bring me a great fulfillment and joy in life.
Yeah.
So I'm very excited to be able to start my practice there, and I'm very excited to meet the folks out there and get to know them, get to really take care of them really well.
Yeah, we have a lot of great physicians who are already out and practicing in our Hemet office. Dr. Madrid is there, Dr. Walt Combs, Dr. Matthew Combs, Anna Diaz is our nurse practitioner. She's just wonderful. And to have you being, a core physician in that office is just something that I'm so excited for the Hemet community and what you're going to be there and what you're going to be offering them.
Thank you.
Thank you so much for taking the time to meet with us today. We're so excited that you're going to be in our Hemet office as our core physician, seeing patients there and just being a foundation of health for the community. And thanks for joining us here from our Sun City office. I'm Dr. Banawa, and we hope to see you soon in the clinic.
See you soon. Thank you so much.